Welcome to the Medical Manners Podcast, where I give healthcare providers simple tips for ways they can transform the way they connect with their patients and colleagues. Connecting with patients isn't some secret sauce that some of us have and others don't. They're just skills, implemented consistently over time. If you want to transform your medical practice, you're in the right place. I'm Katie Wyatt, your host. This episode is sponsored by the Connect Better audio course. This course is for healthcare providers who want to drastically improve their patient satisfaction or Press Ganey scores. Each week for 6 weeks, you will listen to a 5 to 10 minute audio training. Then throughout the week, your job is to implement the skills you're taught in every patient encounter. You'll be amazed at how much your score can improve in such a short amount of time. Go to medicalmanners.com and use the code PODCAST for 10% off the course. I'm excited to have Yoli Olivo on the podcast with us today. Yoli is a certified medical assistant and a good friend of mine. Yoli and I worked together for, I don't know how many years, Yoli? 7?
About, I want to say 8 years.
Yeah. And it's been a minute, but Yoli was always one of my favorite medical assistants, just someone who was really awesome to work with and knows her stuff. So anyways, Yoli, today you and I are going to talk about things that healthcare providers can do that are meaningful to their nurses, their medical assistants, their colleagues, pretty much how to kind of get along with the healthcare team. And I think you're going to have some good ideas for us. So share your wisdom with us.
Well, I haven't always been a medical assistant. As you know, when I first started out, I started out as a receptionist.
Okay.
And so I was doing that for about, I want to say 10 years.
Okay.
And then, of course, I went to school into the medical assistant program. And so after, I got certified and did that, I went into being medical assistant, but I was always interested in learning more, even as a receptionist.
Mm-hmm.
And yeah, one of the things, I remember when I first started was a nurse practitioner that actually hired me. She gave me a chance and she would always teaching me. And so, number one, I think for someone to always willing to teach you something new, to learn different things and to share their knowledge with you is always exciting, I think, for me, definitely.
And I love that because when I think about when I used to be a nurse and I worked at the hospital, I think you're absolutely nailed it with that because there were surgeons that would come through that wouldn't even give you the time of day. It was like they were just too cool, right? That's kind of the vibe they put off. But then there were the surgeons that would be like, "Come here, come look at this." And they'd kind of like teach me like, look at what this is and this is what we're looking for. And it was like they kind of brought you in with them and didn't kind of put themselves on a pedestal. So I had never even thought of that. And I love that you said that. That is so true.
Yes, I always keep that in mind. And somebody that is always willing to teach you and doesn't think, oh, because they're a doctor, or they're a surgeon, or this and that, they're above you. And they're just a person equal as I am, or, their nursing staff, or they're, even receptionist, I say at this point, just somebody who's always willing to teach their staff is, I think, one of the most important things too, for me.
I love that. You've worked with lots of healthcare providers through the years. Is there certain things that they would do or say that were meaningful to you?
I think the biggest thing for me is just acknowledging me as a person. Whether it be you see me down the hall or you see me in the mornings or whatever, is hi, how are you? Goes a long ways. Good morning. I think when people look at me and they don't acknowledge me, that's totally no. That's a big no-no. It's just not a friendly environment. Or it's like, oh, don't talk to me, I'm better than you or whatnot, is kind of the attitude that some have. And I've always, been one like, good morning, how are you, type of thing, or good afternoon or whatnot, or thanks for your help at the end of the day, thanking you for helping them throughout the day. We all get busy and we all go about our days, but I think that thank you goes a long way.
Yeah. Typically, the patient sees the medical assistant or the nurse for longer than they see the provider. And so you being happy and you having a good relationship with the provider you're working for, and you feeling like the provider you're working for is grateful for what you're doing, that goes a long ways. And the patients feel that. They can feel that teamwork, I think.
Right. The minute they walk in, they see the receptionist, but when you take them back, you have that one-on-one with the patient themselves. And so if you have, like I say, a stinky face, they don't want to go in. They're not there because they want to be there. They're there because they have to be there due to their health reasons, and whatnot. And so if you have a bad attitude or you're just like, hi, can I help you? What are we here for? You kind of break the relationship with the patient and the doctor there. I love what I do because I have that one-on-one time with my patients, and I always like to remember what they were going to do or what their vacation was or if
Mm,
they went to go visit somebody, and so that one-on-one I think is important,
yeah.
for anybody.
Yeah.
And having that trust with your patient goes a long ways too.
Yeah.
So
And you were always so good at that. I can still visualize you bringing the patient back, walking with the patient, and you had your blood pressure cuff cart, right? What do we call those things? Dynamaps. You're laughing and talking to the patient. You're just the master at making people feel comfortable and joking with them and laughing with them. You're really, really good at that. One other thing I wanted to mention when we were talking about what's meaningful that healthcare providers do, you mentioned the doctor or provider clinician acknowledging you, right, when you're walking down the hall. And
right.
I always try to train healthcare providers that they need to make sure that their colleagues feel like they're a human. And so one way that you can do that is get to know something about your colleague, your medical assistant, your nurse, something about their personal life, right? They have a trip this weekend. Their mom has been sick. Their son is struggling in school. Whatever, just learn one thing about them because that sends the message to you. Yoli is a human. She has a life outside this office. She's a human being. And so I think that can be really meaningful as providers, if we just look at those around us that we work with regularly and we just say, I'm going to find out one thing about them. And then I'm going to ask them about it occasionally and just kind of check up on them. I think that goes a long ways.
Yeah, for sure. I think just getting to know, like you say, little things, asking a simple, how was your weekend type of thing shows a lot of knows what's going on in my life. He appreciates my time outside of work,
Mm,
just like his, I have mine. Yeah, definitely. Getting to know you as a person is important.
yeah. Yeah. Did you have any other thoughts about things?
Yeah. You treat your nurses right and they'll be good.
Hmm.
They'll be totally loyal to you. Some providers or some places, they think they do all the patient seeing and diagnosing, but we do all the heavy lifting, a lot of the times, and sometimes I think they forget.
Yeah. So when the doctor does something small like leave you a note and a small gift card at Christmas or has extra tickets to a concert and it's like, hey, we're not gonna be able to use these. Could you and your family use them? I mean, are those the things you're talking about where it's just little, they thought of
Just
you.
right. Yep. Just something small, something simple. And yes, you pay me for my work, but there is times that you go above and beyond. If you want me to continue going above and beyond, then show a little appreciation, regardless of whether it's a 10-cent raise or a 50-cent raise or whatnot. That goes a long ways nowadays for your average working, employee.
Yeah, definitely. And if you have a good medical assistant and you've got a medical assistant who's on top of calling back on labs, doing medication refills, keeping everything organized, you can't really put a price on that. That makes or breaks the practice. And a medical assistant probably is going to take whatever job is the highest paying because like you said, $1 an hour is a big difference. You go to the grocery store now and it hurts, right? And
Yeah, for
so
sure.
if the medical assistant has no reason to stay, the medical assistant is just going to take the highest paying job from whoever it is. And so I do think it's important that we do things to help our medical assistants, our nurses feel loyal to where we're at so that we have someone who stays with us for a long time and helps set up systems to improve our practice. And it's kind of like the Costco mentality, right? Costco pays their employees way more than most places around. And people come to Costco and they stay and they work for forever. And so I think you just treat your people right and you've got loyal employees and your business thrives.
Right. Yeah, definitely. Just be courteous to your nurses, to your staff, and show a little appreciation. It goes a long way. It goes a long ways when you treat your employees right, and that way they give you 110%, not just 100%. To
Yeah.
me, that's a big thing, is being treated right, acknowledging me, and letting me have a little bit of input on ideas or throwing ideas out there that can better the business, the patient care or whatnot.
Yeah. Oh, I love that you said that, like letting you have input on things. And I remember you and I worked together when our office was remodeling. They were building a new building. And I remember we had the conversation that they kind of made the floor plans and turned them off. And I remember we said, it might have been nice if they would have asked us. We're the ones running you were the ones running the lab and you were getting the urine specimens and you were rooming patients. And I remember us having that conversation is that would have been nice to have a little input. And so that might be a really great piece of advice for healthcare providers is it means a lot if you ask your nurse or your medical assistant and say, what do you think? What do you think the best way to do this would be? And I think that you come up with a lot of good stuff that way.
Yeah, like you say, we're the ones on the floor, bringing back patients, and we do it every day. And so there's going to be certain things that work a certain way or a layout that is going to work a better way than what they had planned it. And then, so just having a little input, I think,
Yeah.
as well
Yeah.
helps everybody.
So if I summarize, being willing to teach, being a provider who's willing to teach and share knowledge and doesn't come off as better than, showing gratitude and saying thank you and getting to know nurses and medical assistants as a human, and then asking for input and taking advice or input from medical assistants. So I think those are all really good things, and I think it gives me some stuff to work on for sure. Well, thanks, Yoli. That's awesome. I'm excited. I think this is going to help some people. So thanks for taking the time to chat with me about it.
Okay, thanks, Katie. You're welcome.
Thanks for listening. If you enjoyed today's episode, the best way to support what I do is by rating and reviewing the podcast. Your feedback helps me reach more listeners to make an even greater impact. It would also mean the world to me if you would share it with a friend or colleague who you think could benefit from the topics we discuss. Together, we can transform the way we deliver healthcare by transforming the way we connect. Take care.